How can nurse practitioners become advocates for some of our marginalized patients?
I think very much so. Just as we talked earlier and started about social determinants of health, finances, right, and income,
Mhm.
and having that financial mobility is also part of how one gets access to health, right? The
Yeah.
good insurance versus the state insurance, or private insurance versus, I ain't gonna say good, but private, versus state insurance. I think it's important for us to understand too that as a nursing profession, as we are dealing with ensuring that people have access, we are feeling the impacts of this too as individuals and maybe for our families,
Yeah.
right? And so I think we have to sometimes pause and reflect on how are we feeling and how are we showing up for ourselves before we can then continue to talk about how are we showing up for others. Because if our cup isn't filled, we are pouring from nothing. And so I
Right.
think that is important right now as we're going through sort of these administrative changes and these impacts on us, to pause and pay attention to our bodies, especially our folks who have been doing this work for a long time. We want freedom, we want liberation, we want justice. That takes a toll on bodies, especially Black bodies. And we have to understand that,
Yeah.
especially as healthcare professionals,
Yeah.
as we are doing this work. And when your body says pause, rest, you gotta listen to your body. I'm
Mhm.
reading a book now by Trisha Hersey called Rest is Resistance.
Mhm.
And it's a nap, it's part of the nap ministry, which is her work on resting, daydreaming, reimagining,
Mhm.
liberation, and freedom. And I've been reading that for the past 3 weeks on audio, and it is truly changing my heart and my mind and my perspective about the importance of rest and the history of the struggles in our bodies to do. So yes, while it is important for nurses to be doing this advocacy work and looking and taking care of the most vulnerable, because that is what we are obliged to do in our code of ethics, also realizing the impact this is having on us physically and emotionally and mentally and spiritually, and
Yeah.
pausing to do check ins to see how we're feeling individually and then collectively.